in middle and high-income countries, they all have access to healthcare, but why people are healthier than others, and why some people disease affects us more than the others. And what about inequality in the disease during your life course or during your lifetime?
UCL is a great place to study social epidemiology. We've got a large department with about 150 staff. There are over 100 PhD students in the department. We are recognised globally as a leading place for studying epidemiology, and specifically for linking epidemiology to the kind of social, economic and behavioural factors which are so important in understanding how we can improve the population's health.
We try to combine the social side of epidemiology with strong focus on methodology. So we try to look at social determinants of health, social inequalities, and to see why studying social inequalities is important. But at the same time, we try to prepare our students for future jobs, so we put a very strong focus on methodology and on statistics in particular.
The program is focused on the major public health concerns, so the public health issues, and this is very important in our society today. As you mentioned, that there's a huge social gradient in various countries, and the distribution of health is different within and between the countries, and social epidemiology allows us to study this specific area.
I think that the big difference in comparison with what I have learned for my undergraduate is the practical side of it. Because as I said, after the course directly you will have practicals with your peer students, so you can understand the concept much better. And also they got a lot of social events. They invite other researchers and professors from other universities to give us lectures, and afterwards you can have social drinks with them, and you can just voice what you think about with them, and they won't look down upon you because you are too naive. So it's very good experience to exchange and broaden your social network as well.
So we're looking for students who come from a range of backgrounds. They might have done medicine, but equally they might have done statistics, and they're interested in health. We have lots of students who've studied public health in the past. They may have studied sociology. We've had a number of students who've done a politics degree and who've switched. So we are open to a broad range of students, but the key factors that must motivate them is an interest in public health or in population health, and also in terms of skill, we want people who feel very happy doing major number crunching.
Many of our students continue their studies as a PhD students. In addition to that, quite few students go to jobs as public health departments, and some students work, for example, for the UK government. Some overseas students go back to their countries and work for their public institutions, for their universities or their governments and ministries. I could say that within 1 year, between 90% and 100% of our students find a job or continue their study as PhDs.